So this woman is claiming that the clinic inappropriately pushed for children to receive gender-affirming care when it wasn't a great idea and possibly against parents' wishes. But apparently, she had no way of knowing that if that was the case, because she's not present in these exams, in these medical rooms where the treatment is actually happening and these discussions are actually taking place. She has nothing to do with that. So she did this whole report, did a sworn affidavit to try to get this place shut down, but she couldn't even have seen the things that she's claiming to have seen. So, welcome everybody. If you have not been with us on Twitch, we've been playing some Halo, but Halo's over for now because we got some important things to talk about. Well, Halo's important too, but we have some other more pressing matters to talk about. Namely, what we have to discuss is the fact that the right is trying to destroy access to health care for transgender folks. This is something they've been doing for a long time, but they've been especially successful at it lately. So I don't know if you recall, but Matt Walsh did find a whistleblower at a gender clinic, not the one that we're going to discuss, but he found one and he used that to launch a successful campaign that got that clinic shut down. That clinic was not really doing anything wrong, to be honest, but they just succumbed to the pressure. They tried this again. There was another quote-unquote whistleblower talking about bad behavior at this gender clinic. And well, it turned out not to be true at all. So that's what we're going to be discussing today. But first, just so that we understand what's on the line, so that we understand why these people are doing what they're doing, we have a little clip to play for you. This is the Daily Wire's Michael Knowles explaining exactly what his intentions are for the trans community. Let's have a little listen. If you're on TikTok and you want to see the video, you can go over to Twitch, but you'll be able to hear it on here as well. But if you want to actually see the video we're talking about and see the article that we go over in a little bit, join me on Twitch. I'm Arcane Arya on both. But if you just want to hang out on TikTok and just listen, that's totally fine too. Feel free to comment and ask questions and that sort of thing in the chat on either platform. And of course, if you have something that you would like to say, you can request guest access here on TikTok, and we can get into guests in a little bit too. But let's go ahead and play this clip so that we understand exactly what the stakes are and what we're dealing with. This is Daily Wire's Michael Knowles. Let's have a listen.
The big issue that they had.
Hypermonkey says, just like the Covenant trying to destroy humanity. Yeah, except the Covenant tries to destroy humanity in like a fun way, where we get to fight with like plasma blasters and swords and shit. This is just not fun. This is just shitty.
Yesterday, which was then picked up in other media outlets as well, is that I called to ban transgenderism entirely. I made the point that if you want women to have their own bathrooms, if you think women ought to be able to have their own locker rooms and not have to look at gigantic, gross men while little girls are getting changed, if
Hello,
you want
Katari,
any of those things
on Twitch,
you have to ban transgenderism entirely. It's not enough to say, well, you have to wait until you're 12 or whatever people are saying now. It has to be the whole thing, because if men have the right to behave as women and identify as women for the purposes of public life, then women can't have their own spaces. And
so that's what we're dealing with. So he's made it pretty clear. The agenda is to remove trans people from public life entirely. And in alignment with that, they have decided to try to remove any avenues that we have for healthcare. Because when transgender people don't receive healthcare, what usually happens? Well, I wouldn't say what usually happens, but what often happens is that they become more depressed, more anxious, and more suicidal. Their suicide ideation has been proven to increase when they are denied medical care. And of course, more dead trans is exactly in line with Mr. Knowles' goal and with the goal of the right. So it's no surprise that they're trying to shut these clinics down. So let's move on to the article. So this is from St. Louis Today. The title, Parents Push Back on Allegations Against St. Louis Transgender Center, saying, quote, I'm baffled. Again, if you're on TikTok and you want to read the article along with me and see it on your screen, go on over to Twitch, Arcane Arya on both platforms. but it's totally fine to hang out on TikTok and just listen as well. So explosive allegations made public last month about a St. Louis clinic that treats transgender children have flung parents into a vortex of emotions, shock, confusion, anger, and fear. Kim Hutton, among those confused by the reports, views the treatment her son, now 19, received from Washington University's Transgender Center at St. Louis Children's Hospital as vital to making him the outgoing college freshman he is today. Boy, isn't that the truth? How many of you have known a transgender person who has, when they've been given the opportunity to transition, suddenly become much more confident and happy and outgoing? That's a very common experience. The idea that nobody got information, this is a quote, the idea that nobody got information, that everybody was pushed toward treatment is just not true. It's devastating, Hutton said. I am baffled by it. So that was the allegations that were made by this so-called whistleblower that worked at the clinic, not in any capacity where she would actually be able to view the things that she's claiming happened. But she did work at the clinic, and she claimed that people were being pushed to and essentially forced to undergo gender transition, especially children were being forced to undergo gender transition. But according to what we're reading here from the parents themselves, they're saying that's not the case. Almost 24 parents of children seen at the clinic, which opened in 2017, say their experiences sharply contradict the examples supplied by Jamie Reed, a case manager who left the WU Center after being employed there for more than 4 years. Reed outlined her concerns in an article published online February 9th. Her sworn affidavit, which includes additional allegations, was released that day by Missouri Attorney General Andrew Bailey, who is leading the state investigation. Bo Katari, help. Yeah, it is a little bit distressing, but I think we're gonna make it through this. But I understand where you're coming from. Bailey demanded an immediate moratorium on prescriptions of puberty-blocking drugs and cross-sex hormones for new patients. Leaders at Washington U and BJC Healthcare Center rejected that, but pledged to establish, quote, additional oversight, which as far as I'm aware is not necessary, but I think they're trying to be as cautious as possible, considering the attention that this is getting, and considering that this same sort of behavior in the past has led to literal bomb threats against other children's hospitals. And let's be clear here, this is a children's hospital. This is a department within a children's hospital. That's what conservatives are going after. They're going after these places that provide health care to everybody, not just trans people. I need to turn my light down just a little bit. I'll be right back. Okay, much better. Now TikTok can actually see me, or Twitch rather can actually see me. Reed of South County alleges that families were rushed towards medical intervention without regard to whether that was a rough sentence. Let's try that again. Reed of South St. Louis County alleges that families were rushed towards medical interventions without regard to whether adolescents were in extreme mental health distress. She claims side effects were glossed over and drugs were prescribed even if one parent did not consent. So what she's describing here is what the right and what conservatives have been trying to say happens at these gender clinics when a children goes in and says, hey, I played with a doll today. They're like, cool, you need to go on hormones right now and we're chopping your wiener off, right? That's what they're saying. That's what Ms. Reed here is also alleging happened at this children's hospital. But as we will find out, that is not actually the case. Parents interviewed by the Post-Dispatch cast doubt on Reed's ability to know what happened inside exam rooms as an employee who did not have a medical or managerial role and whom they rarely ever saw. The case manager's job duties, as described in a Washington U posting, comprise patient intake, scheduling appointments, and providing information about community resources to families. So this woman is claiming that the clinic inappropriately pushed for children to receive gender-affirming care when it wasn't a great idea and possibly against parents' wishes. But apparently, she had no way of knowing if that was the case because she's not present in these exams, in these medical rooms where the treatment is actually happening and these discussions are actually taking place. She has nothing to do with that. So she did this whole report, did a sworn affidavit to try to get this place shut down, but she couldn't even have seen the things that she's claiming to have seen. Reed emailed parents with reminders asking them to contact her with questions. The printouts that were attached detailed medical protocols, including side effects, risk, and responsibility. They were being a responsible clinic. They were warning of the potential dangers of these treatments. You know, the sort of thing that conservatives, that the right, that Reed would probably say do not happen. But in reality, they do happen. And in fact, she was helping them do it. They listed contact information for dozens of local wraparound services, LGBTQ advocacy organizations, and licensed mental health professionals. It's a very wise precaution to take. It's not even really a precaution, it's just taking care of your patients. Patients recounted that the staff explained procedures using both medical and everyday vocabulary. The doctor reached out to me after hours, this is a quote, to answer my questions and make sure I understood what my treatment plan was, said a 16-year-old from St. Louis area. By the way, in case you're wondering, the sort of treatment that's being referred to here is not surgery. So I know like a lot of people on the right have this idea that there's all kinds of kids that are getting like that are getting sex reassignment surgery, that are getting like they're getting bottom surgery, or there's just a whole bunch of like little kids getting top surgery. I specifically have heard many claims that elementary school students are getting double mastectomies, things like that. That is not what's being referred to when we talk about 16-year-olds receiving gender-affirming care. What we're talking about when it comes to somebody of that age, well, there's kind of two levels of it. So there's like the I guess you would say like the therapy level, where they kind of talk with you. They go through, they consider comorbidities and that sort of thing, but and then they talk to you about your gender identity and kind of help you sort things out. But what they don't do is they don't argue with you about it. They don't say you are wrong. And the reason they don't do that is because studies have shown that when transgender children are subjected to that kind of treatment, it damages their mental health. It increases their rates of anxiety, depression, suicidal ideation. And so it has the exact opposite effect of what you're wanting if you're a healthcare provider, if you're trying to care for these people. So instead, what the guidelines have always been is to just still discuss all these other potential problems and everything. Definitely make sure that they know what they're getting into and all of that before they start receiving like hormones or puberty blockers or whatever. But simply just don't argue with them. Don't tell them that their identity is wrong. That's all that we're talking about. And then the other level is that when they begin adolescence, when they begin puberty, the option of puberty blockers are available. So we're not talking about hormone replacement therapy. We're not talking about, making permanent changes to the body. What we're talking about is simply delaying puberty. So if a child has been expressing gender nonconformity and they express that wish and they go through all the proper channels and that sort of thing, then they are given the option of going on puberty blockers. What that does, it doesn't stop puberty from happening. It simply delays it. So you stay on the puberty blockers until you're 18 years old, until you're an adult. Then you can choose to go off of them if you want to and just have the adolescence that corresponds with your gender assigned at birth if you decide that you want to back out of it. You can also back out before that point. As a teenager, they can say, you know what, I don't want to do this whole puberty blocker thing. I want to go through the puberty that corresponds with my gender assigned at birth. That's also a possibility. Or, they get to age 18, they're like, yes, I am definitely transgender, and then they go through puberty at that time, and that puberty corresponds with their actual gender, the gender they actually identify with. The sort of puberty they would go through without that would do damage to their body. It would cause irreversible damage because the changes that occur would not be congruent with their actual gender. It would just simply be congruent with their gender assigned at birth. So the puberty blockers protect the children from harm, and we wait until they're an adult before they can make the permanent changes that hormone replacement therapy carries with it. It's that simple. That is what is meant by gender-affirming care for children, especially for children of this age, of 16 years old that we're talking about. That's what conservatives are trying to shut down. That's what they're trying to demonize here and trying to present as like genital mutilation and that sort of thing. The doctor reached out to me after hours to answer my questions, this is a quote, and make sure I understood what my treatment plan was, said a 16-year-old from the St. Louis area. Rather than the rapid medicalization and, quote, poor assessment of mental health concerns, that Reed cited in their complaint. In January, parents reported a well-defined step-by-step approach that could be halted at any time. Slow, methodical adjustments began at home, long before medications were used. Testing out new names, using different pronouns, cutting hair short, or growing it long. The social transitions ran concurrently with medical health care, sometimes lasting years. Only then, parents said, was medication considered. So this is even a higher standard than what I was talking about, because this is requiring, it sounds like, they're requiring a certain level of social transition and a certain amount of time on social transition before they would allow things like puberty blockers, which may be a wise precaution. I'm not a doctor. Many parents spoke on the condition of anonymity to protect their children. Anti-trans rhetoric has heated up in the fallout from Reed's allegations. Thank you for the likes, everybody. Anti-trans rhetoric has heated up in the fallout from Reed's allegations, energizing lawmakers in the Republican-led Capitol. At least 27 bills targeting LGBTQ rights have been introduced in the Missouri legislature this session, including half a dozen that seek to limit health care. And it's definitely not uncommon for states to be introducing anti-trans legislation lately, but 27 bills is a lot. And we have to imagine that a lot of this has been inspired by the claims that Ms. Reed brought forth, which we are now finding out are not remotely true, and that she had no way, even if it was true, she would have no way of knowing about all this stuff. Reed declined to be interviewed for this story. Shocker. But responded in a statement provided by St. Louis County Councilman Ernie Tracus, one of her lawyers, with the Child and Parent Rights Campaign. Who is this Child and Parent Rights Campaign? I bet this is some turf shit. What is this? Oh, yeah. Dude, we saw a lawyer from this organization testifying at, it was a hearing in Virginia. A member of our community was there and pointed it out to us because she was fucking crazy. It's like she was saying the most unhinged, crazy shit. So yeah, this is like a turf lawyer group that helps children prevent their kids from getting medical care and other bad. This is a bad group. Oh God, how do I even explain this well? I'm not sure that I can. Restoring parents' voices in their local public schools, opting out of objectionable instruction. Notice of non-consent has prepared sample notices for parents to inform schools that they are withholding consent for their child to participate in activities, counseling, or interventions that promote social transitioning or affirming of gender other than child's sex. Very cool. Thanks for all your hard work, childrenparentrights.org. Anyway. It's not surprising to me that the negatively affected families have not yet come forward. Parents have a strong instinct to protect their children's privacy, the statement reads, conflating short-term patient satisfaction with which some patients refer to as the period of hormone high, never heard that before in my life, with good medical outcomes is the kind of misguided thinking that contributed to the opioid epidemic. Wow. What an insane fucking take. So she's arguing that we are conflating short-term patient satisfaction, aka the hormone high. I've never heard anybody call that. I think she made that up. They're saying that we are mixing that up with good medical outcomes. What? That is a good medical outcome. If a child is depressed and they feel better, that's a good medical outcome. What the fuck is a good medical outcome to you? How is that like the opioid epidemic? The opioid epidemic is not remotely related. The reason the opioid epidemic happened is because it was a very convenient way to treat a lot of patients, and drug companies knew this. They also knew that the drug was highly addictive, and so they encouraged doctors to prescribe it as much as possible so that they could receive lifelong patients. That's the reason for the opioid epidemic. That's not even close to what she's claiming is happening. What she's claiming is happening is that kids are becoming happy when they're on hormones, which, yeah, a transgender person would be happy if they were given hormones and they didn't have access to it, I suppose. But that's not even true because these kids aren't given hormones. They're given puberty blockers until they're adults and then they're given hormones. So what the fuck are we even talking about? The shit this lady is saying is melting my fucking brain. I feel like I'm having a meltdown right now. Whatever. Regret often comes later, according to the statement. Harm will ensue if it concludes. Okay. Major medical organizations such as the American Academy of Pediatrics and the Endocrine Society, actual doctors, actual medical organizations, they have said they endorse puberty blockers and hormones as best practices in the care of transgender children. They say that the mental health ramifications of not addressing the needs of such patients put them in peril. That is so true. Mixed Cassandra says, hormone high? I wish. I just get cramps and I cry more. Yeah, I never experienced a hormone high. I definitely experienced a lot less anxiety and felt more comfortable in my body, and my moment-to-moment experience was not as darkly colored by dysphoria when I got access to hormones. But I didn't experience a hormone high. I've literally never heard this from another person in my entire life. The first person I've heard this from is this chick who's this turf bitch who's trying to shut down a children's hospital. So I think we can accurately conclude that was entirely made up for her stupid report. Just like everything else in her report was made up, because again, she was not present in any of these rooms where the exams were going on, where any treatment was taking place. She was a case manager. She scheduled appointments. She gave lists of organizations where you can get help from. That's what she did. She has no way of knowing that any of this shit that she's talking about even happened. And then she's making up some shit about a hormone high. I don't even fucking know. So, some chick says it's bad. Major medical organizations say it's good. In her allegations, Reed references patients with severe mental illness, claiming in a first-person narrative published online by the Free Press, so not even in her report, just in some random article, that, quote, our doctors viewed gender transition, even with all the expense and hardship it entailed, as the solution. Well, I suppose it depends on the solution to what problem. If the question is this a solution to your depression? Well, the answer is probably no, though it would certainly help. It may be damn near impossible for you to responsibly, or not responsibly, but to treat your depression well, when you're also battling gender dysphoria to that degree. It might be impossible. So maybe I wouldn't say it's the solution to depression, but it's probably a piece of the puzzle. But if the problem that we're trying to solve is gender dysphoria, then that is exactly the solution. So I would hope that the hospital would consider that as a solution. That is literally the only solution to that problem. Did you see what Tennessee did? Yes, I unfortunately did. Quite unfortunately. Hi, I'm a trans man from the UK. I am so sorry to hear that. Not that you're a trans man. That's wonderful. What I'm sorry to hear is that you're in the UK. That sounds really rough. I'm sorry to hear it. I mean, obviously things aren't going much better over here in the US, so I guess we're kind of all in the same boat. Yeah, Mixed Cassandra gives you hugs. You deserve hugs. Tough situation over there. I guess we can count our blessings that at the very least, I suppose it depends on where you are in the country, but where I live, more or less, if you're an adult, you can go to Planned Parenthood and you can get hormone replacement therapy. Yeah, I don't know of anything like that. I don't think anything like that exists in the UK. I think everyone in the UK relies on the NHS for it, unless they can afford a private practice, which very few people can. And NHS is total shit when it comes to actually getting treatment for transgender patients. They completely gutted marriage equality. Yep. I am in the US, unfortunately. I was exposed as Dracula. That'd be pretty cool. Dracula's like a queer icon. I don't consider that an insult. What a shitty insult. And all you did was get banned. That sucks. Come on, man. At least be creative. You know how many fucking people have called me a vampire on here? You can make fun of me if you want to. You just gotta be funny about it. That wasn't even that funny. Come on. You guys can do better. One St. Louis area parent interviewed by the Post-Dispatch questions the need for transgender centers across the board, saying they push families to funnel all their concerns about their child into one issue. The parent's teenager has been diagnosed with a long list of mental and behavioral issues and in the past has threatened suicide. So we're talking about a parent who does not support their child's transition, thinks it's a bad thing, believes transition in general is a bad thing, it sounds like. And despite the fact that their child is experiencing all of these mental health issues and has experienced suicidality, most likely due to the fact that they are transgender and are going untreated. So that's the kind of parent we're dealing with here. While in elementary school, the child was evaluated by an endocrinologist. The family went to conferences and tried a support group, and their child made a social transition. I was apprehensive, the parent said. I was open to all the options for treatment. You have a child, you want the best outcomes and the least amount of impacts. Which is a normal thing for parents to say. That's like a good sentiment for a parent to have for their child, I suppose. The teenager has been seeing a psychiatrist for about a decade, but with the teen's complicated history, the parent wants additional time and therapy before any future medical interventions. The parent believes more therapy, focused on other mental health concerns, could resolve the gender dysphoria. That is not true. If you're experiencing gender dysphoria, by definition, is being caused by incongruency with your gender. That's what that means. So again, we see a parent, an ignorant, bigoted parent, overriding the good medical sense of the doctors. Though she does admit here, they have not forced us to do anything, the parent said about the WU Center. Typical right-wing fabrication from whole cloth. Yeah, though I would say, no, you're right. I was about to say this is atypical, but because it's been effective, but that's actually not true, because the reason they're doing this is because it has been effective. They have shut down gender clinics by doing this sort of thing in the past, and they're trying it again. So yeah, everything about that statement is 100% correct. This is typical, this is right-wing, and it is fabrication. That's all that this is. But there was still pressure. The article says that. I don't see why. Citation needed. Doctors and therapists often mention the suicide risk, yes, and untreated transgender use, which the parents took as a scare tactic. The conflict has been a strain on the family. Well, that's not a scare tactic, and that's not pressure. Pretty irritated that this article, which has been pretty good so far, says that there was pressure. That's not pressure. That's reporting the symptoms of the child to the parent. I thought that's what conservatives want. I thought the complaint that conservatives had is that the parents aren't being informed about what's going on. And then when they are informed, they're saying, oh, that's a scare tactic. It's putting pressure on us to let our child transition and be happy. The parent does not want the transgender center shut down. Well, that's good. But said the approach should be broader with extended psychotherapy for patients. So psychotherapy and puberty blockers are not mutually exclusive. I am willing to bet that just about every single transgender teenager that is currently on puberty blockers is probably also going to therapy. I don't think that they would give you that without therapy. They wouldn't give me an adult hormone replacement therapy without seeing a psychotherapist for a while. There's no way they're letting kids do that. In the absence of the truth, reactionaries rely on repeating the lie until it becomes normalized, says Mix Cassandra on TikTok. That's the truth. Conservatives always play the con game. It's the only game they have. They used to try to argue with us on this issue. They used to try to say that it actually wasn't good for transgender people to transition, that it actually harmed our mental health, that it caused us to be more suicidal and cause all sorts of other health risks. That's what they used to say. But you may notice they don't do that anymore because there have been more studies now, and they don't have any legs to stand on. There used to be just so few studies that they could cite, just the 2 or 3 that were commonly available that had extremely small sample size and were biased, and they were actually able to make coherent arguments against transgenderism that was convincing to a lot of people. But now there's so much knowledge out there that they don't have any leg to stand on. So many people are educated about this issue that when they talk about it, when they try to say that sex and gender are the same thing as an example, everybody just knows that's not true anymore. So that doesn't work out. So they've stopped that. They stopped trying to argue. They don't have an argument anymore. Now they're just relying on force. And make no mistake about it, that's what this is. This is the use of force. This is making up lies to create government intervention to shut this down. The only way the government is able to accomplish anything is through the use of force, of course. So that's exactly what this is. Ultimately, this is a violent, forceful intervention to just shut down a children's hospital. That's what we're talking about here. At St. Louis County, a St. Louis County mother recounts a different experience. Her daughter's mental health crisis escalated when she started middle school and began cutting herself. The girl's depression spiraled. By freshman year, she could barely crawl out of bed, her mother said. The family met with the team at the Transgender Center. Everyone was in agreement that we needed to get her depression under control before we talked about hormones, the mother said. The focus was getting her healthy. Well, there you go. Her ex-husband had a lot of questions, and, quote, the clinic was adamant we be in agreement before moving forward, the mother said. Their daughter, now 18, was ultimately the one who convinced them. And so I don't even agree with this sentiment. I don't agree that they should have sought the consent of the father. If the parent, if they have a guardian that's wanting them to transition, and their dysphoria is so bad that they're in danger of killing themselves, then yeah, who gives a shit what the father says? But they did. This clinic did. So what Reed said about them is just an outright lie. Their daughter's depression didn't disappear, but its symptoms abated. The teen finally felt comfortable in her body. That's good to hear. Many of the families interviewed said the children had worked with multiple mental health specialists to address diagnoses ranging from anxiety and autism, oh, tell me about it, to more debilitating conditions such as borderline personality disorder. My dude, anxiety is very debilitating. Depression, self-harm, and suicidal ideation among transgender youths occurred more frequently than in the general population, with research indicating a 40% suicide attempt rate. Which, of course, the goal of all of this for conservatives is to get that number up. Those are rookie numbers as far as they're concerned. Can you imagine all other life-saving interventions that'll be disputed too? Plays into austerity. I suppose it does play into austerity in kind of a sick way. I suppose we are perceived sort of as expensive people to live in society and drains on the medical system. So yeah, that's a good point. That is a good point. Cruelty is the point, says Mix Cassandra. Yes, that is a good way to put it. One study published in the Journal of the American Medical Association last year found that gender-affirming care lowered the risk of depression and suicide for transgender teenagers. The same study asserts that transgender youths are disproportionately burdened by poor mental health outcomes, likely due to social rejection, lack of parental support, and bullying. Note that that is not due to receiving gender-affirming care. For one, because many of them are not receiving gender-affirming care. And for two, because gender-affirming care would actually improve those outcomes. Amy Kafer of Columbia, Missouri, credits the treatment her daughter, now 19, received at the WU Center with saving her life. By the time she was 12, Kafer's daughter had attempted suicide. Kafer and her husband pulled the girl out of school. She met with a psychologist every week. So this kid was suicidal. This girl was suicidal. Her life was at risk. And this clinic saved her life, according to the parents. Conservatives want to shut this place down. If this place was closed when this child was seeking treatment, they wouldn't be alive right now. So that's the goal. Remember earlier we watched Michael Knowles tell us about how he wants to remove transgender people from society altogether, and that's the only agenda the right can have in this regard, is what he said. Well, they mean it. They are trying to remove us from public life by killing us off. They want to close down the hospitals that save our lives. They want to close down the hospital that saved this child's life. If they had started this campaign earlier, and if they were successful, this child would be dead, at least according to the parents. At 13, the girl was able to... It took 6 months to tease out what was going on, Kafer said. At 13, the girl was able to tell her parents she was transgender. She chose a new name and wore girl clothes. 2 years later, she started on estrogen. At clinic appointments, Dr. Christopher Lewis, the pediatric endocrinologist who co-founded the WU Center, would draw pictures on the exam table's paper cover to illustrate what the hormones do, what side effects to watch for, and what she could expect her body to look like as estrogen levels inched up towards a maintenance dose, Kafer said. And I can tell you that the physical changes that came along with HRT have done probably more than just about anything to help me with my gender dysphoria. Because every single day I see myself in the mirror and I look different. Every single day. The whole silhouette of my body looks different. I mean, just everything. So, and looking at my skin looks completely different. It looks like, I mean, I have girl's skin now. It's pretty awesome. Every time I look at my hands, I see that. So I have this constant reminder that I am a woman. So when society is trying to tell me that I'm not, when all the religious trauma is trying to tell me that I'm not, all that sort of thing, all I got to do is just look down at my hands, and I see girl hands. That's made a big difference. The daughter of a Clayton couple articulated her gender identity at a much earlier age than Kafer's daughter. She's a cut and dried story, said the mom. The parents talked to the pediatrician while the girl was still a preschooler. They found a therapist. A social transition followed. When their daughter was 9, they visited the transgender center. So wait, the daughter of a Clayton couple, okay. Oh, they're saying that she said that she was transgender much earlier than the others. I have not seen you before an actor, actually. But you do look wonderful. So I am very certain that you are a great case example of what HRT can do. The parents talked to the pediatrician while the girl was still a preschooler. They found a therapist. A social transition followed. When their daughter was 9, they visited the transgender center. We didn't take this lightly. We wanted to give her every choice, said her mom. They waited for signs of puberty. After a threshold of estrogen and testosterone has been reached, blockers are an option. Just exactly like we said. Gender-affirming care does not mean doing surgery on a child's genitals. It does not mean performing double mastectomies on 9-year-olds, like everyone's saying. It involves like psychotherapy and puberty blockers. Blockers are considered off-label for gender issues and have been used for decades to suppress precocious puberty in very young children and to treat cancer and endometriosis. In other words, they're given to children all the time. Puberty blockers can cause bone density loss, so adolescents undergo regular bone screenings. So I'm not aware of the drugs that are in question directly contributing to bone density loss. It's possible that's the case. I definitely haven't read all the literature. I'm not aware of that. What they might be referring to is there have been studies that have been done on trans femme individuals, so like trans women mostly, femme identified individuals that are receiving that would have gone through male puberty, but because they're on the hormone blockers, they're not going through that. And so what the hormone blockers do in that case is they block testosterone. Testosterone increases bone density. So what the studies that I have seen that they could be referring to, they compared these transgender women with cis men, or rather these transgender teenagers with cis boys, and compared the bone density and found that those that were on puberty blockers because they were trans girls did in fact have lower bone density, which of course because they're not absorbing testosterone the way that their cis male peers are. The other issue is that studies have shown that that trans femme individuals have a lower bone density both before and after transition on average. So there's something about our bodies, even in our bones, that is more in line with the opposite sex than it is congruent with our gender assigned at birth in a lot of ways. I don't know why that is, but there have been a number of studies that have shown that both before and after transition, transgender women have lower bone density. So I don't actually think that puberty blockers themselves cause lower bone density. I'm prepared to be wrong about that. Even if it were true, though, it still doesn't justify not giving it to children who it's the best treatment option for. If patients press forward with feminizing or masculinizing hormones, peer-reviewed, thanks, yes, peer-reviewed, that's exactly what I'm talking about. If patients press forward with feminizing or masculinizing hormones, they acquire secondary sex characteristics that align with their identity. Estrogen redistributes weight in transgender girls so they develop breasts and wider hips. Based. Testosterone deepens the voice, broadens the shoulders, and thickens body hair on transgender boy. Cool for you guys. Sounds gross to me, but if that's what you're into, go for it. If hormones are stopped, some changes reverse. Others are permanent. Side effects include increased risk for blood clots, diabetes, and heart disease. So actually that part, as far as I'm aware, is true. I have found some references that there is a slightly increased risk of blood clots, diabetes, and heart disease. But I also think that this, again, plays into the fact that a lot of what they're talking about is transgender girls who are receiving anti-androgens. They're receiving drugs that block testosterone. Let's see here. Oh no, we're not talking about puberty blockers anymore, though. We're talking about HRT. And so yeah, so that is true. Your risk of blood clots, diabetes, and heart disease, all those things are increased if you're a transgender woman on HRT. That's true, but that's just because your hormone profile is different, and that's true of all people with that hormone profile. That's true of cis women. So the only reason that your risk is increasing is because it's increasing to be in line with what it would be for cis women. It's no more than their cis counterparts, though. Exactly, that's what I'm trying to say. And you said it much more succinctly than I did. You need to run. Okay, we'll see you around, Mix Cassandra. I was really glad that you were here while you were able to be. 5 years ago, the National Institutes of Health embarked, to go back, I know of no evidence that receiving testosterone for trans-masc people increases blood clots, diabetes, and heart disease. I know of no such study that says that. So again, this article is not being entirely accurate. 5 years ago, the National Institutes of Health embarked on a comprehensive $5.7 million study of medical treatments on transgender youth, so the first of its kind. But long-term outcomes remain largely unknown. That is because it takes a long time for us to get those long-term outcomes. 5 years is not enough time. Side effects are no minor concern for Tim and Melissa Durker of Maplewood. Their 12-year-old daughter is on the cusp of being ready for puberty blockers. Excuse me. In each of their 4 appointments so far, they've meticulously reviewed options with the medical staff at the center, which include an endocrinologist, a doctor of adolescent medicine, a gynecologist, a nurse practitioner, a nutritionist, a psychologist, and a psychiatrist. Why do transgender want to be called the gender itself? I don't know what that means. Could you please rephrase the question? That was Purple Bliss on TikTok. Each appointment involves blood tests to check their daughter's hormone levels, a mental health survey, question and answer sessions, and paperwork. Every time we go in there, it's more informational, said Tim Durker. I would say it's the easiest decision. It's okay to admit that you don't understand. Life's not a binary. No shit. Hey, what do you know? Lewis, the endocrinologist, declined to comment for this story, citing legal advice. In January, he and Dr. Sarah Garwood, the Transgender Center's other founder, submitted written testimony for a hearing at the State House on a bill that aims to prohibit gender-affirming care for minors. Most of their patients are neither on puberty blockers nor hormone therapy, they testified. So they testified in an actual hearing that actually most of their patients aren't even on these drugs. So remember, this whole thing started with somebody who worked at the clinic, didn't work in a role where she could know these things, but whatever, we'll ignore that for now. Someone who worked at the clinic said that this shit was being overprescribed, that parents and patients were being pushed, being forced, that the decision was being rammed down their throat, that they were just shoving funnels in these people's faces and just pouring estradiol into their mouths, right? But actually what we're finding is that the vast majority of their patients weren't even on puberty blockers or hormone replacement therapy. This is a quote, for prepubertal, that's a new word for me. For prepubertal children, the focus at the center is on psychosocial support and family education only. The word only is part of the quote. The statement reads, not every teen needs or wants to begin hormones or have a puberty blocker before age 18 or ever. The experience of being trans is different for each individual. Directly debunking the claim of the whistleblower, of Reed. Reed's affidavit asserted that the center never discontinues cross-sex hormones, no matter the outcome. Okay. But 17-year-old Chloe Clark of St. Louis, who told her parents she was transgender in middle school, halted her estrogen therapy a year ago. Well, there you go. She was happy with her transformation, leaving her somewhat in the middle of the gender spectrum, she said, and didn't feel she needed the drugs anymore. Well, it turned out that was a lie. What are the Fruit Loops so worried about what the kids want? What? Why are the Fruit Loops so worried about what the kids want? Who are the Fruit Loops in this case? Chloe Mark? Oh my God. What happened to Chloe Mark? Is that someone who is like known? I have not heard that name before. Her parents and doctors were supportive of her decision, she said. So the doctors were supportive of her decision to no longer be on hormone replacement therapy. Reed claims they never end that therapy, no matter what. No, Clark. I don't know what you mean. I'm so sorry. And her parents and doctors were supportive. It was amazing, Chloe said. Oh, here's a picture of her. Chloe, oh, no, here's a picture of them. I wish they wouldn't have said her so much in this article. Chloe Clark, 17, who identifies as non-binary, sits in their home. God, what in the world? These fucking idiots. Sits in their home Sunday, February 26, 2023 in St. Louis. Chloe received estrogen therapy from Washington University's Transgender Center at St. Louis's Children's Hospital. Ultimately, they took the Hippocratic Oath, says Clark of the doctors there. They're going to do what's in the best interest of these kids. And I picked this article because it was the best one that I could find on this, and there's still like misgendering people in the article. It's ridiculous. The whistleblower report also claimed Lewis and Garwood lied about not doing surgeries on minors, saying the center, quote, regularly refers minors for gender transition surgery. In an April interview, Lewis said surgery is not offered to anyone under 18. Oh, womp womp. Damn. Sucks when you just like make shit up and then people are able to prove that it's not true. That really sucks. It must be tough to be a conservative. Surgery is what Christine Hyman's 17-year-old son wanted from his very first appointment at the Transgender Center when he was just 12. Well, of course, that's understandable. He brought a blue Post-it with him and 3 questions written. When can I start testosterone? When can I have top surgery? And how can I get my dad on board quicker? I am smelling some autism here. That sounds like something I would do. The answer he received for all 3, said Hyman, was to give it time. Oops, this doesn't fit the narrative. Must be tough to be so confused on life. Yeah, well, I mean, conservatism is a mental illness, and it's a very serious one. And we should definitely extend our sympathies to the people who suffer under it. Put it out of your mind. We don't do that here, Hyman of St. Charles recalled the nurse telling her son about surgery. You don't walk in Tuesday morning as a girl and walk out Tuesday afternoon as a boy. That's not a thing. Which is true. That's not a thing, conservatives. Please listen. That doesn't happen. He had to be patient with the other 2 questions as well. His dad pored over studies, which they discussed as a family. He came around. Oh, you're talking about me, huh? So confused on life. What exactly am I confused about? I'm very curious to get your take. What am I confused about? Tell me more. Tell me more, Dylan Durson. Are you saying Chloe Cole? I keep hearing Chloe Clark. Let me go back. Their name is Chloe Clark. Chloe Clark is a non-binary teenager that was treated at this clinic. He had to be patient with the other 2 questions as well. His dad pored over studies, which they discussed as a family, and he came around. Hyman's son saw a therapist for more than a year, 89 times. Hyman said before he started testosterone, ahead of that, he was also counseled on preserving his fertility, which is usually comprised once cross hormones are introduced. A window can be opened between blockers and hormones to allow eggs or sperm to be collected and frozen. Something I didn't do. Different Chloe. Yeah, different Chloe. I think we were talking about 2 different people. The center helped with non-medical issues too, Hyman said. It recommended barbers, clothing stores, and legal aid agencies. Hey, that's the sort of thing that Reed would do, the person who wrote this report. She would refer people to external agencies and make appointments. So she could have talked about that. But instead, she just decided to make a bunch of shit up. Hey, Ari, if you need a moderator for your lives, I got you. Seth, okay. Hey, if you're the Seth that I know, that's even cooler. But if you want to moderate for me, I'm super grateful. The way to do that is to send me a DM. Just got to send me a DM, and then we'll talk it out. If you're not able to send me a DM, that means we're not friends, so follow me, and I'll try to remember to follow you if we aren't already following each other. Hyman's son saw a therapist for more than a year, 89 times, Hyman said, before he started testosterone. Ahead of that, he was also counseled. Oh, we already went over this. Jess Jones, another case, who identifies as non-binary and uses they pronouns, worked at the Transgender Center from 2018 until 2020 as an educational liaison. Jones led trainings at schools and coordinated with teachers, administrators, and families to ensure students felt safe. Oh yeah, you're going to leave the circus as soon as I ask for specifics, but that's fine. You can go run along home. You can be a coward. I knew that's what you were probably going to do anyway. It's what I expected. Jones bristled at the way they said Reed sometimes spoke about patients. Oh, interesting. How passionately she worked as a case manager felt at odds with how she talked about transgender people, Jones said. Jones recounted Reed telling them that misgendering, or using the wrong gender or pronouns to describe a person, in case you didn't know what that meant, was, quote, exposure therapy. Wow. That would keep trans children from being coddled and encourage them to develop thick skin. Jesus Christ, how did this woman have a job there for so long? If the clinic did anything fucking wrong, it's not firing this bitch years earlier. It is you. Oh, well, thank you for being here. I'm really glad that you're here. And yeah, we'll definitely set it up. And if for some reason I forget to make sure that we're able to message each other, hit me up, because I don't want to forget that. Jones complained about Reed at the center's directors, or to the center's directors and human resources, and was not the only one to do so, they said. Reed acknowledged in the Free Press narrative that she received a negative performance review in 2021. I would hope so. But I hope... hey, what's up, Moonami? I feel like she should have been fired if that was her attitude. If her attitude was that we should misgender patients to toughen them up, then she probably shouldn't be working at a fucking gender clinic for kids. Why does this person think their opinions matter? Why do you think that your opinions matter, Jeffrey? Jones quit the educational liaison position the year before that. Jamie was the primary reason I left, said Jones, who now lives out of state, but they still support the mission of the Transgender Center. They said and do not abhor or do not harbor doubts that protocols are stringently followed or that patients' mental health is being tended to. They have a holistic and comprehensive approach, Jones says. This was an initiative that was really trailblazing. In the past few years, the number of Americans who say they are transgender has mushroomed. In 2017, an analysis by the Williams Institute, a public policy research group at UCLA, found about 1.4 million people, or less than 1% of the population, identified as transgender. A 2021 update noted an increase of 200,000 across the population, with a spike among those younger than 25. In that cohort, 3% identified as trans. I believe when they say that cohort, they're talking about people under 25. I'm not surprised by that. Young people feel a lot more comfortable, especially in this day and age, coming out as transgender because they've seen a whole generation of people that have been, or well, not a whole generation of people, but a generation has come up before them where a lot of us were able to do that. And just generally speaking, apart from developments in recent years, the environment has been much more accepting of trans people. On top of that, because the environment has been much more accepting towards trans people, people of all ages, more of us have been transitioning. And that's not a bad thing. What's probably happening is that transgenderism was underreported in the past and now is being more accurately reported because more of us feel comfortable coming out and talking about it. Click 3 times. Damn, there's some disrespectful ass people in your comments. I could wipe all of them out for you. Well, please don't wipe people out. We don't wipe people out around here, but I appreciate the sentiment, and they sure are assholes. Non-commercial. When someone joins a live and accuses the host of thinking the host's opinion matters. Yeah, why the fuck are you even here? That's all this shit is, bro. Mere tricks. At least they're making it easier to report and block them by identifying themselves. Precisely. And if you feel that reporting and blocking is appropriate in this case, you are encouraged to do so. It's hard to buy back time you feel that you have lost. You don't have to be here. If you don't want to be here, I do not want you here. Right, like go do your own live. Oh, right, yeah. Oh, right, you don't have 1,000 followers, so you can't do your own live. So you got to come in here and raise shit in mine. Because you can't get followers. No one wants to listen to your bullshit. Let's get back to the article. The Transgender Center has also experienced an uptick, seeing about 250 first-time patients a year. Some migrated across the SSM Cardinal Glennon Children's Hospital in late 2019. Migrated over from, rather. When the Archdiocese of St. Louis clamped down on the treatment of transgender adolescents. That's a huge problem, too. So a lot of, hey, Bambos is Vinny. What's up, Vinny? They're probably trans and uncomfortable about their own feelings. A lot of times that's the case, right? Also, a lot of times they're chasers. I know this because they send me private messages. But yeah, this is a big problem. So a lot of these hospitals that have been set up, these children's hospitals that have existed for like in some cases literally over a century, they were founded by religious organizations and they're still run by religious organizations. And I would say in recent decades, a lot of those organizations have really clamped down on the treatments that are going on in those hospitals and sort of enforced their religious dogmas on doctors and patients and that sort of thing who have no connection to their religion whatsoever. It's really unfortunate. And it's affecting people. I mean, so this shut down the gender-affirming care program for children at this particular hospital. Thankfully, some other hospital was able to pick up the slack, but if not, that person that we were reading about earlier who was suicidal and who that clinic saved her life might not be with us anymore. Just because some fucking archdiocese wants to make people who don't even, aren't even part of their religion live the way that they think they should live. Fly away with his big eyes. I have no idea what that means. The Transgender Center has also experienced, we talked about that. Reed argued the rise shows the social contagion at play. Oh, here we go. Somebody read Abigail Schreier's book. Is that her name, Abigail Schreier? She wrote Irreversible Damage. Figure this out. I can type. Yeah, Abigail. Where's her last name? Abigail Schreier. Turf and Chief. She literally wrote the playbook on being a turf. And Dennis Prager likes her a lot. Michael Knowles. Ooh, what does Michael Knowles have to say about her? Abigail Schreier dares to tell the truth about a monstrous ideological fad that has already ruined countless children's lives. History will look kindly on her courage. Oh boy. Christian conservative. Let's go ahead and tap on your name here. And we will just go ahead and block you. Okay, bye-bye. Turf and cheap sounds apropos. It sure is. Some would argue that J.K. Rowling is the turf in chief. And I suppose that she is a bit of a figurehead. But Abigail Schreier has provided the intellectual framework for their arguments largely. Very, very popular, very popular book. It was promoted on the Joe Rogan show as an example. And in it, she essentially argues that there's like an epidemic of trans mask people. like the infected in Last of Us. They're just like trans masks are just spreading and taking over the earth, and we need to create quarantine zones to protect us from the trans men. There's just all these trans men, and they're just fucking hopped up on testosterone. They're trying to kill us all. That's what Abigail Schreier's book is about. Book reviews by Aria. Follow me for more book reviews. Reed argued that the rise shows a social contagion. Social contagion is taken right out of that book. That's why I was talking about it at play. When I said the clusters of girls streaming into our service looked as if their gender issues might be a manifestation of social contagion, the doctor said gender identity reflected something innate. Yeah, they told you the right thing, buddy. She wrote in the Free Press article. In her affidavit, she said social media, including TikTok, is at least partially responsible. So congratulations, guys. We are at least partially responsible for the hordes of trans masks that are ravaging the world right now and ending humanity. I, for one, am proud of my involvement in that. Lewis, in April, said the causes were manifold. Students were more supportive, families are listening, quality of care has improved, along with insurance coverage. Insurance coverage is a big deal. So in case you don't know, another way that conservatives are trying to mass unalive us is they're trying to make it untenable for insurance companies and medical providers. Happy Puritan is on Twitch. Hello, thank you so much for joining us. I would be happy to get your take on this issue, by the way. What was I talking about? I got distracted because Happy Puritan showed up. Oh, insurance. So yeah, a big part of their agenda in wiping us out is to make it so that doctors and insurance companies can no longer viably provide health care for us. Because as we just discussed, when we don't have access to health care, many of us lose our lives because of it. And that's what they want. They want to extinguish us from existence. And so they are targeting insurance companies. They are passing state-level laws, and also states play a role in picking what exactly their insurers can and cannot cover. And there are many states that are making it difficult for insurance companies, to cover many of the most effective gender-affirming treatments. They're also introducing new bills that are essentially like banning those treatments, right? And or making doctors like way beyond liable for those treatments to an extent where they just can't do them anymore. Where like they could be sued if someone like feels a little bit sad about their surgery, 30 years down the line, that sort of thing. So they're making it impossible for us to receive medical treatment because the people who give us that medical treatment, it's not safe for them to do so. So that's what's going on with the insurance companies. And people are aware of other services we offer, Lewis said. One mother from a town in northeast Missouri believes her 24-year-old child was influenced by Facebook in a social circle to come out as a transgender man at 19. And then, so we got some misgendering here. So the parent says of their transgender son, she's prone to hasty decisions and chameleon-like lifestyle, the mother said, still using female pronouns for her child. Her child began receiving testosterone at the transgender center against his parents' wishes, but after he was legally an adult. So they will say things happen against parents' wishes, and they will say they are doing things to minors. But they will say it in the same sentence to make it sound like things are being done against parents' wishes to minors. But as we've seen already, that is actually not the case. So the only time anything is happening against a parent's wishes is when an adult is requesting the services, which is exactly what they should be doing. More misgendering from the mother. She's happy with the care that she received. Well, she's so happy. If he's happy with it, why do you insist on consistently misgendering him? Because I'm tired of people thinking they can go ahead and damage people for no reason. That's what Mooney said. Mooney, what are you talking about? What's an American tradition? What's the war in Ukraine? My dude, are you okay? Mooney, are you all right? Are you doing all right now? I'm worried about you. I'm worried about you, buddy. I have no idea what you're trying to say either. Please clarify. A longtime friend of Reed's may be the person most dumbfounded by her allegations. This is where shit gets kind of spicy. The mother from South St. Louis has known Reed for more than a decade, since their kids were tiny. The mother's younger child, now 16, began questioning their gender in 6th grade. 2 years ago, after several suicide attempts and forced days at a psychiatric hospital, he came out as trans. He continued with psychotherapy and in June met with Garwood at the Transgender Center. He has been on testosterone for 3 months. It's not a decision you make lightly, the mother said. You don't rush into something like that. Reed's free press jaw dropper blindsided her. She felt betrayed. Last year, the mother had texted Reed that her son would be starting a hormone regimen. If Reed, her friend, was worried it was dangerous, why wouldn't she have said something, the mother questioned. So in other words, hey, Anwell. So in other words, Reed, the whistleblower, the quote-unquote whistleblower, had a close friend with a transgender child, and they didn't say anything about their transition being a bad thing. So if this person has such a strong conviction that underage people shouldn't be given access to gender-affirming care, why didn't she do something about it? Especially if she cares so much about it that she's trying to literally shut down a children's hospital. The worst thing about it, she said, is people start getting paranoid and they start doing terrible things to trans people. My kids are scared. And people are, in fact, doing terrible things to trans people, and we are, in fact, scared. Hey, Mooney Me, I noticed that you haven't responded to my question. I'm curious to know if you're going to. Well, that's the end of that article. Actually, that's a pretty good way to end it off. The worst thing about it, people are starting to get paranoid. They're starting doing terrible things to trans people, and my kids are scared. French fries, ooh, woo. That is how I feel about French fries. Are those French fries? Yeah, those French fries. I love me some French fries. I have very fond feelings for French fries, personally.